Okay, I hope you're ready to meet Dr. Griffin Cole as he explains how to avoid a heart attack by eliminating infections. This presentation will warn you about the most dangerous bacteria that threaten your heart and how to safely get rid of them. You'll also find out how to get the best dental checkup and why this can literally save your life. Plus, pay close attention to Dr. Cole's final warning about picking the right dentist, especially if you are dealing with an underlying health problem. Enjoy this presentation with Dr. Griffin Cole. So, Dr. Cole, first of all, thank you very much for coming all the way from Texas to join us here. Look, a lot of people I know are listening to this, and they've either had a heart attack, and they don't want to have another one, obviously, or they're very concerned about their heart health, and they don't want to have that first heart attack, which in many cases is the first sign for so many people that, wow, there's a heart problem when they have a heart attack. I want people to listen to you really carefully because a lot of what's going on in the mouth has a lot to do with the development of plaque in the arteries, and I don't think a lot of people are hearing this message. So just talk to us about this. How is there a connection?
So, for years we've known, not only in our field, but in medicine in general, that there's a connection between oral bacteria and the same bacteria in the plaques of the heart arteries. So we've always known that, right? So if we had patients that had some plaque or tartar buildup, we'd say, hey, you should probably have your heart checked. But I don't think we ever really realized how strong of a connection it really is. In fact, it may be the cause of coronary artery disease in that there are over 500 species of bacteria in the mouth, over 500. And when somebody has any kind of pH change in their mouth, a little bit more acid, those bacteria flourish. And they travel easily through the bloodstream, they get into the heart arteries, and boom, now we've got heart attacks. And they won't often say that was the cause, but the truth is if you assay or culture that bacteria, you're going to find a lot of oral bacteria.
A lot of cardiologists are still not there, are they, in terms of, their mindset is they see the plaque in and around the heart, and all they want to do is, quote unquote, treat it and give medications and stuff. There's no conversation like this still, even to this day. We've known each other for years, right?
For years, and I've got good friends who are cardiologists, and they will still to my face argue with me about it. And they'll say, you go with statin drugs, that's how you fix it.
So you want to get into some of the bacteria that people should be aware of, and then of course we can talk about how to test them, but let's identify the real, you said there's over 500.
Yeah.
We're not going to do 500 in this conversation today, but let's get over some of the biggies. Let's go over some of that.
Okay, so P. gingivalis, it's P. gingivalis, is probably the most prevalent one that they find in all the plaques. There's Treponema denticola, T. forsythia, and the worst player of all is Fusobacterium nucleatum, F. nucleatum. This guy is so powerful, he likes to co-infect with other bacteria and can take the increase into endothelial cells 20-fold, so it makes the infection so much worse. And this is the one that we find in very high numbers in the plaques. So we know that just those 4 come directly from the mouth. As I mentioned, there's a lot more. So
let me backstep for just a moment, because a lot of people who might be new to this information, I think the mentality in Western medicine is to stay very focused in one area. If there's a problem in the mouth, that's where it is. If there's a problem in your brain, dementia. If you have a problem in your heart, heart disease. If you have a problem with your kidneys, go to a kidney specialist. How on earth does a problem, why don't we backstep a little bit, a problem like plaque in the mouth, how does that translate to getting in and around the heart? How does that work? Explain it to people who are new to this.
Honestly, it can travel lots of ways, right? Just even in our swallowing, if you will. But it's mostly from infection in the mouth, right? Some kind of change, as I mentioned, in the pH, something that is off. And this gets in your bloodstream and travels. And it's not only the heart, Jonathan. It gets to the pancreas, the kidneys. They have found it in autopsies in many organs.
So am I hearing you right? You're talking about literally If it's there in the mouth and you're eating and drinking, saliva mixing with all the stuff you have, you swallow it, it gets into your gut, it goes into your lymphatics, it goes into your bloodstream. This is a real connection.
Real connection. But if you are in a healthy state, and we'll talk about that in a bit, where your pH is good, you're alkaline. Okay, the chances are going to be a lot less than if you're acidic. So that's what this is all about, is that we all have this bacteria, right? People talk about good and bad. It's not about that. We have over 500 species in our mouth. How do we maintain a nice commensal homeostatic environment to where we don't have to worry about this, right? And we'll get into that in a bit, I know.
Yeah, and we're going to identify and get into this bacteria a little bit more and all of that. But before we get there, another thing that's very clear that people should understand is that if they're okay now, it's based on their lifestyle and their age. And over time, if their lifestyle changes and they become more acidic, the same stuff that was in them before where everything was okay, now it's when it becomes problematic, right?
That's exactly right. That's exactly right. So if you want to get into ways that we can prevent this, that'd be great.
Yeah.
So first and foremost, because I've already mentioned this a couple times, a good alkaline diet, right? Green leafy vegetables. We've been taught this since we were children. It still holds true, right? And a lot of people like animal flesh, which I do too. A lot of the meats are very acidic, so you got to know what you're eating, how it's raised, grass raised, all those things. You have to use good home care. And what I mean by that is just simple brushing and flossing. The average person brushes 30 to 45 seconds. It should be 2 minutes, right? Thorough. It's not hard. It's not aggressive. It's just spending the time cleaning all the surfaces. And flossing, not too long ago there was some article saying that flossing is unnecessary. I strongly disagree with that. There is nothing like a piece of string rubbing between those teeth to wipe the plaque off.
Just conventionally speaking,
Yeah.
What you just said, why are they saying to people that they shouldn't floss? What's the rationale?
You know what? That's a great question. I read the article and still didn't understand it. I think they were saying, their argument was that when you take the string, you can shove things under the gum, right? Which really isn't true. Yes, you can, but it's the movement. Just wiping it off of the static surfaces is what's so effective. You can rinse out after, right, and get the stuff that's loosely laying there. So it was a weird argument, and I think it was, honestly, Jonathan, I think it was more of a sales pitch for some of these water pick things that are these water flossers. I think is what it mostly was. It's always somehow industry.
And it just seems like it's common sense because there is physical material that can be left in between the teeth, and especially if you're not brushing long enough. But even if you do, you're not going to get every single thing between the teeth.
That's right. That's exactly right. Warm saltwater gargles. People don't realize that salt water is antibacterial, right? Because of its tonicity, it sort of sucks the water out of the bacteria. So that's another simple thing to do at home to just lower the count, right? Keeping things alkaline, keeping things as clean as possible. These are simple things we can all do. Doesn't cost any money, and you can keep those bacterial counts down.
What about conventionally on the market, which has got to be millions and millions a year, the alcohol-based, all those mouthwashes where you see the commercials, they are literally brainwashing people into believing that if you just use these products, you're going to have squeaky clean, fresh mouth with none of those nasty buggies attacking you at all. The commercials are, very expensive commercials. What's the story with that, Dr. Cole? Is there validity to it?
No, there's not. In fact, they did some studies recently where they looked at molecular iodine, right? Just iodine, but a special form, not your normal povidone, but molecular. It's many species of iodine mixed together. What they found was this, that not only did it inactivate strep mutans, Streptococcus mutans, which is the main bacteria that causes cavities, right? That's the one in our mouth that causes actual decay. Not only did it inactivate it immediately, but when they compared to Scope, Listerine, Colgate Total, those did nothing. They were virtually completely ineffective. The kill rate on molecular iodine was so fast and so much more thorough. It wasn't even a contest.
So just to be clear, the alcohol, which is a big part, correct me if I'm wrong.
Big part.
Isn't it a big part of those products? And I think most people would naturally think, quite innocently, alcohol's got to be the key to killing it. Is alcohol the effective part at killing bacteria?
No. Now, alcohol, as you mentioned, can kill a little bit, but it's about 25% alcohol, like in Listerine, let's say. But why the alcohol is added? It's for that burning effect is what it is. It feels like it's working, right? You feel that in your mouth and you feel like it's working, but it's virtually ineffective against most of these gram-negative anaerobes that we're talking about, like Fusobacterium nucleatum. So
I'm just curious about something else as well. When we talk about the destructive nature of these bacteria, I'm already thinking, but I want to get your answer on it, that I guess it depends on if somebody is 25, ignoring something for 6 months, versus perhaps somebody super stressed out, many, many years of destructive lifestyle habits, 60, 70 years old. Is it a different thing? How fast, is my question to you, would this bacteria really have a very negative effect or develop this kind of plaque? Is that a hard thing to evaluate in terms of how long this can go on before somebody is going to be, in trouble?
that's a great question because as a dentist, I see patients come in with, like I'll ask them, when was the last time that you were professionally cleaned? And most of them are 6 months ago, but some of them are 10 years, 12 years, 15 years. And I don't necessarily see in the ones that are 10 years any worse off than those that did it 6 months ago. So as you and I talked earlier about, there's lots of things involved besides your genetics, your diet, your home care, all that. So that's a good question. I do know this. I do know that people ages 30 to 65, 47% of those people in America have some form of gum disease, okay? Which, as we know, that's the bacteria that's going to lead to the heart disease. Over 65, 71%. We're talking about 3/4 of the population in America alone have some form of gum disease, which has the bacteria, which gets in the plaques of the arteries. So here's what I'm saying. I didn't believe this until really quite recently. I think that maybe my field, this is the key, right? If we get this clean, maybe we knock out the number one killer still, coronary artery disease, number one killer still. Maybe we knock that out completely.
And can you speak to this idea that, in your world, the people that go through your doors are people that are more naturally inclined, though, right? So maybe take a bigger look at this. And is there much of a difference is really my question to you, Dr. Cole. People coming to you, you're also a naturopath as well, and you've been a holistic, biological type dentist your whole career. So is your world a little bit more of an exception to the rule, or would you say that a lot of people, even living a healthy lifestyle, taking supplements, eating an organic diet, they're at risk for all of these bad buggies as well? Is that fair to say?
That is fair to say. Yes, you're right. I am in sort of a bubble, and that a lot of my clientele are very health conscious, very health oriented, and so you're right. But let's talk about that because there have been some recent studies. In 2017, there was a genome study, and they have now found more than 50 genes that actually will make you prematurely susceptible to coronary artery disease. So over 50 genes now that we found. So there might be people out there living a beautifully healthy life, and unfortunately they're susceptible still to getting CA.
Well, but also, I was just listening to that thinking, if they're slightly off, but thinking they're doing really well, if they have a greater tendency towards it, they just have to be super careful, right? Fair?
That's it. Super vigilant. Yeah, that's exactly right.
So what about testing? All right, we walk into any dentist. Can any dentist give us a good evaluation? In my mind, I would think no, you have to be careful, but just address that, okay?
Yeah, nowadays we can do some basic DNA testing through their saliva. We can do some microscope evaluation. That's all fine and dandy. You'll see the same bacteria under the scope. I don't know that that's that great of an option. More importantly, when somebody goes to find out, well, what caused my heart disease, and they actually assay the plaques, they can do some fluorescence testing, lighting testing. They can do cultures. Cultures is probably the most effective. And when they do that, they find a ton of oral bacteria. The lion's share of it is oral bacteria.
I know that in a dental office that I went to, only one in my whole life is where I got an education about the phase contrast microscope.
Yeah.
And also they were teaching me about the levels. 1, 2, 3, 4. 1 is great. 4 is you don't want to be there. You want to talk about that because it blew my mind that something so simple you could do early on to evaluate all the buggies in the mouth and how much traffic you have going on there is not done by any other dentist that I ever went to. And I was into natural health. I thought I knew everything. This periotherapist taught me a lot. You want to address just this test?
I think you're talking about the classifications of levels. Let's go even simpler than that. Probing, just gum line probing, is something that we were taught, they probably learned about the mid-'60s. And I bet if you walked into 10 offices, 5 of them aren't even doing it. Simple. Measuring, how far does my probe go into the gum, right? Simple test. 3 millimeters or less, no bleeding, that's healthy, right? Low probing depths, but bleeds pretty easily, gingivitis. Very correctable. Probing depths now getting to 4 millimeters, 5 millimeters, 6, God forbid, worse than that, we're in full-blown gum disease. Still reversible, right? We can still treat this. But this person's probably already has things happening in the heart arteries as well.
Talk to those people out there who are going to a conventional dentist. I'm just curious, because it's been a long time since I've been to one.
Yeah.
What exactly are they told? Like, let's say they are probing and they say, whoa, there's a deep pocket there. Is it almost like a lot of them aren't even being told anything? If the patient isn't complaining and they notice that, they're like, oh, how is everything? Oh, everything's fine. Or are they actually saying something at least to the patient? What's going on out there?
So almost nobody complains, to be honest. It's a painless disease. Even in advanced stages, it's painless. Now, you and I both know you spit blood in the sink, you have a bad taste, somebody tells you you smell. Those are signs, right? But what dentists are taught, what I was taught, is kill. Kill the bacteria. Kill. And that's not the way you treat. It's not about killing, right? That's going to buy you a little bit of time. You might drop your antibody level a little bit, your IgG, your IgA. But the bottom line is that you're not going to be to the level of a healthy person no matter how much therapy you do, right? So as a dentist, we're taught, okay, I probed you, you got gum disease, I need to scrape, right? Scale the teeth, root plane, make them smooth, put you on some kind of antibacterial, maybe some antibiotics under the gum, maybe some oral antibiotics, rinse out with this chlorhexidine gluconate, this terrible antibacterial solution that stains your teeth, makes your food taste bad. This is what we're taught.
It sounds just like the cancer industry. If you have cancer cells, that's bad. Go in, kill it, and then there's all this collateral damage.
Same thing. It's the exact same thing. And as I mentioned, even the ones that listen, scaling and root planing is effective. Scraping the teeth, getting the barnacles off the boat, if you will, that's effective. But it doesn't fix the problem. It just sort of buys you time. We got to get to the heart, right? The functional medicine, the diet, the home care, certain medicinals you can take that are healthy, supplements, oils, right? Certain essential oils you can do. There's a lot of things you can do.
But remind people then, why don't we break out a little bit? Again, I know a lot of people that tend to be into health come and see you, but I would imagine you still see that new person was like, whoa, the mouth is a mess and I have to bring you along. What does that typical person look like? What are they doing that there's so much bad buggies running amok in the mouth? Because it's one thing to say, well, it's an acidic lifestyle, but identify it, you know?
Well, first and foremost, blood sugar levels, right? Diabetics, they have a hard time. They just do. I would say that's the number one person who is affected by gum disease and the bad anaerobes, if you will. People with lifestyles that involve smoking, alcohol, things that we've been told for years, right? These things too, this forms an acidic environment. So those are the ones that I see immediately. I don't see a lot of smokers. But the few that I do, there's not a single one that has healthy gums.
Well, you just triggered me off on something. I'm curious. Even the quote-unquote healthy types who are eating all organic and juicing, what about those lovers of sugar where their blood sugars are maybe higher? They perceive themselves as healthy. I don't know if you're seeing those people, if you sense that there is a problem, and maybe almost in a sense, those are tougher people to talk to because they think they're having a healthy lifestyle, but they're leaning towards organic sugars in energy bars, the sticky stuff that's on their teeth, or they're juicing too much fruit. Am I going in the right direction or no, not at all?
No, you totally are. In fact, it's a very delicate conversation. So let me tell you how I do it, because I think it's the nicest way to do this without being insulting. First question I ask somebody when I'm sitting with them like this is I say, tell me about your overall health. How would you classify your overall health on a scale from 1 to 10, 10 being excellent? And most people say I'm a 9, right? I'm a 9. Tell me why. I exercise. I'm in great shape. So then we go through this whole family. We talk about everything, and then the last question I ask is, how would you classify your oral health on a scale from 1 to 10? Same scale, 5, 4 or 5. And all I say is that even possible? How can you have 4 oral health and a 9 overall? And that's all. That's enough. Then they're already thinking, he's right. How can I have that? So it's a nice way to just, without being insulting, you can't have bad oral health and good overall health.
But where is that coming from? I'm curious. How could someone who feels, that's really interesting, who feels so strongly in a positive way about their health, their overall health, why is it they're classifying their oral health? Just because simply they don't brush enough and they feel guilty? I mean, is that what's coming out at the end? Or how could they possibly say it's a 5?
Western medicine. I mean, we've been told that the mouth is a separate entity, right? I mean, even dentists, they treat it completely different. That's why you hear people, how can a root canal affect other parts of my body? That's impossible. It's in my mouth. So this is something that we've been taught in Western medicine our whole lives and still are. So I think that whole mantra is in our heads, right, that mouth is separate. I can have a terrible mouth, but I'm healthy overall. Like you mentioned, the ones that eat organic and they're juicing and they're doing. And I look in the mouth and I think, this is not healthy. Your gums are not pink. They're bleeding. I'm barely touching them. So you're right. It can happen to a lot of different people.
So again, identifying some of those things, it's something I have talked about in the past, but now that you're in the chair here, I got to confirm it with you.
Okay.
Eating these organic, sugary-based things like this sticky energy bars and things, you really have to be careful with that stuff. If you tend to be slightly acidic or you have any kind of gum disease, isn't that fair to say?
Absolutely fair, for sure. I don't, people think that they eat something that's gluten-free or it's organic, but it's loaded with sugars, as you say. Whether they're natural or not, it's still sugar. One of the most acid-producing things in our body and one of the worst things for our mouth. Bacteria flourish. They love it. So you're right. I mean, eat organic vegetables and organic fruits and whatever else you want to do. It kind of comes down to common sense. It really does. From basic, not what we were taught with the food pyramid. Things that those of us who actually look into truly eating healthy foods know.
So going back to the microscope I mentioned, how does that work in a dental practice and how can that help somebody to understand what's happening in their mouth? Explain that a little bit.
So any kind of microscopy is great, right? Because you can see what kind of bacteria that they actually have in the mouth. And there are some that are terrible, like spirochetes, very smelly. Those are ones that look a certain way on the microscope. You can see which are gram-negative and gram-positive, right, by how they color. I think it's very important. I did it for years in my office to just to be able to identify, because there are certain bacteria, again, that we all have, no big deal. But if you've got a large number of, say, spirochetes, as I mentioned, that's a bad thing.
And
So-
all they're doing is taking a little saliva, putting
saliva.
it on a slide,
That's it.
sticking it under a microscope.
That's it. And you see them swimming around on the screen, and you can see immediately. And it's very powerful for a patient sometimes because I don't think they really realize how many bugs we have going on. It's pretty telling when you lay it on a screen. And so it's a great tool as far as knowing what you have in your mouth. And then at that point, now it dictates, well, your plan. How are we going to get rid of this? How can we do this naturally? And what can you as my dentist do?
And I made a mention before about level 1 to 4. 1 is like, you correct me if I'm wrong, a moon crater, very quiet. That's what we all want to see somewhat. And number 4 is like rush hour, in LA or
Right.
New York City. It's
Right.
like that. So people can measure this. How important is this in terms of giving people feedback? You mentioned also about probing for pockets,
Yeah.
because that's where the bacteria sit in the mouth and fester and can spread throughout the whole body. Every time you go to the dentist, isn't it important to keep records and to let someone know whether you're here and it's getting worse, or you're here and it's getting better, you're on the right track?
No question.
This feedback is so important.
No question. It's like, show me, don't tell me, right? Show me what's going on. And I love how you said that because that's how I do it. I describe the problem before we ever do it. So when I'm calling out the numbers now to my assistant, they understand the numbers. And you have to document that. And if you do any kind of things under the microscope, you have to document those, right? And then, like you said, retest along the way, right? Because listen, cleaning the teeth is effective, as I mentioned. It does help. It's not the end all, but it helps. So you can document that. And hopefully you've had some counseling with, supplements and diet and all that, to where the patient is your co-partner in this, right? It's their mouth, their body. So we give them all the information, the tools. Hopefully they comply. You come back, you see the improvement. That's exciting.
I've been spoiled, I have to be honest with you, Dr. Cole, because I came from New York. I'm down here now in Florida, and I miss my periotherapist. she did 6 points on every tooth.
Right.
It was the outer
Right.
3 points,
Yep.
number, 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 just to be very detailed with people. Then the inside of each tooth, number, 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 and moved on to the next numbered tooth. And on every visit I went, she had my pocket size number every single visit. And it was, she knew I was a health nut guy and I'm on the internet and I do all this oral health education and blah, blah, blah. It did not matter. She checked for cancer, if I had any cancer in my mouth area, oral cancers. She did the light stuff. She did all of these things with me to make sure each and every time, no matter what I told her.
Jonathan, that's the standard of care, honestly. Every single dentist, whether you're biologic like me or you're mainstream, you're supposed to do that on every patient.
So let's get into it a little bit more, because obviously somebody has a heart attack and it's like, duh, I must have a heart problem. That's obvious. But what are some of the other things that are going on that you really look at that tell you, Dr. Cole, hey, you can tell somebody, you're at risk for a heart attack in the future?
Yeah, so I'd have to involve their physician in the process because these are testing that a dentist wouldn't do. But there's an increase in cytokines in the body, right? Your interleukin, interferon, your growth factors, those increase immediately whenever this is going on. There is a increase in inflammatory mediators like prostaglandins that show up. And you know this, the liver will release C-reactive protein, CRP, whenever it notices that interleukin-6 is being secreted by macrophages and T cells. It gets released because it knows that there's inflammation in the body. So these processes all happen that go on that tell us there's inflammation, there's definitely some plaque being built. You know that something bad's about to happen.
And let me make this connection for people as they're listening to this. It's really important that they work with a great biological dentist who has that good, easy connection with possibly being able to reach out to a practitioner, another healthcare provider who can get these numbers. Because in my mind, and correct me if I'm wrong, somebody's markers are going up and they keep going up and they're not getting under control. Now we go right back to our whole discussion before. They're more prone to those same bad buggies in the mouth growing out of control. When the markers start going up, it's just easier for all of this to get worse and worse. Isn't that fair to say?
That's very fair. And most dentists don't. In fact, I don't know really that many dentists at all that do this, but oftentimes I'll ask them to get some blood work done, right? Just a basic panel. We just want to see. Maybe a complete metabolic panel as well. We want to see what's going on, right? Because you're right. If you're not working with other doctors as a team, I mean, there's only so much I can do, right? So that's a very good comment because, if you're not working with naturopaths, with functional medicine doctors, chiropractors, acupuncturists, whatever the like, they're all important in this. Lymph drainage specialists, craniosacral. I have a beautiful circle of friends that are all involved with that, so it's total care.
Okay, so one last thing I want to touch on that I hope people appreciate with what I'm going to bring out. And I don't think I'm putting you on the spot, but I think it's an important thing to air out now before somebody goes into a dental office. The comment you made before about only so far you can go. Yeah. I've pointed this out from time to time in the past, but I think it's a real, no pun intended here, a real sticking point. Yeah. And that is when somebody goes into the dental office of a biological dentist, well, why don't they tell me all this, Jonathan? I listened to this in the summit, and you know what? I don't think I have the right dentist because they're not coming off and sounding like you, Jonathan, and Dr. Cole in the docu class, and you know where I'm going with this. I want you to really speak candidly about the position you're in as a dentist, what you will do professionally, and what you do want people to know when they come in. My whole point has been, it is on us, meaning us as patients, as individuals, to be more proactive, to learn about these things, to understand these things, to ask for some assistance. But there is only so far, my point being, you can't just go to a dentist and say, hey, Mr. or Mrs. Dentist, is this situation that I have going on in my mouth, is this going to threaten my heart health? It's a little tricky, right? Explain it.
It is tricky, but I think that people need to be enlightened, and that's what these summits are all about, right? And people like you out there. As a biologic dentist, that's a choice, right? That's not a degree. It's like we're all general dentists, and some of us became more enlightened, if you will, and more educated, and we're constantly learning. And for me, it was a no-brainer that the mouth and the body were connected, and how much more can I learn about this? Constantly learning, right? Still learning. Almost 30 years in practice. So mainstream dentistry, unfortunately, and I was taught the same way, is taught basically drill and fill, right? What tooth hurts? Let me fill it. You have an infection. Here's an antibiotic. Your tooth has an abscess. Let's do a root canal. And that's really all. That's pretty much it. So you don't even get into the whole focus of what's going on in your body, like you said. There are these signals that happen in the body that tell you something's going on, right? We have to measure this. So why I love my niche, if you will, is because we look at everything and we have conversations like this. And patients need to arm themselves with information. You need to be your own doctor. And my patients come in, they are extremely educated, right? Sometimes they challenge me. They'll bring up a thing that I haven't even heard yet. I love that because that's the only way that we're all going to figure out health and get to that point.
But I mean, on a practical level, it is a little tricky that I always try to get people to understand the concept that it really shouldn't be the approach of you go in there more aimlessly and say, hey, Dr. Cole, if I get rid of my mercury fillings or if I reduce this bacteria in my mouth, this will help me to prevent a heart attack, right? There are certain things that as a dentist they need to appreciate. You have to be careful because you have licensing boards and all of this stuff is going on behind the scenes. And it's not that what I'm saying is the person has malicious intent asking these questions, but they may be frustrated if they're kind of looking for you to tell them this is the connection, rather than perhaps probably the best of all worlds, and correct me if I'm wrong, the person goes in educated and just lets you know this is what they would like you to help them with. Place their order, if you will, at the restaurant, at the dentist. Say, this is what I want because I understand that this will help me to reduce my risk. Can you help me, yes or no? That's a far more comfortable relationship to have. Am I right?
You're right. I still offer half-hour, no-charge consultations. Come in and meet me. Interview me. Let's sit down and just talk. Maybe I'm not the right person for you. I don't know. But that... And no other dentist does that. I mean, no one has 30 minutes to give away for free. But I think it's important because it's the only way that I'm going to know, can I help you? And do you feel like you're in the right place? Right? You have to ask those. You need to arm yourself with information. Hopefully we made that point. And that's what these summits are about. But you need to do your own study as well. Learn what's going on with your body. And bring your intuition and your thoughts to the dentist and to any doctor and share them. And if the dentist acts defensive or acts angry, then leave. That's not the right office for you.
Thanks, Dr. Cole.
Yeah.
Next up, I'd like you to meet Dr. Todd Watts as he exposes several astonishing truths about how cellular energy is directly linked to your heart function and why infections must be eliminated. I'm sure you would agree that hypertension is dangerous, but Dr. Watts reveals a vital message for all those suffering with low blood pressure. And finally, are you eating really well and still struggling with health issues? Then be sure to listen carefully to this upcoming life-saving message from Dr. Watts about what to focus on next. Enjoy. So, Dr. Watts, thank you very much for coming all the way from Idaho, right?
Idaho, yes.
I appreciate you being here. You know, a lot of these speakers we've talked, obviously, I know a lot of people also get it out there listening to us. Cellular health really matters. That's obvious. But mitochondria, people have heard about it. They kind of know a little something about it, but we haven't really gotten into it that much. And I know you are going to give us a lot of great information. So where do we begin?
So we begin with the fact that the heart has approximately up to 5,000 mitochondria per cell. It takes about 40% of the cellular matrix. So there's got to be a reason why the mitochondria is important in the heart. And that's because it requires a lot of energy to function, right? And so there's a lot of things that can interfere with that, and that's what we're going to talk about today. What are those things?
So help us to understand then, what are some of the roles that the mitochondria play then with heart function?
So the mitochondria plays a massive role in energy. And the first thing that we see with the mitochondria is that it produces this molecule called ATP. It fuels the body really to do all kinds of reactions. And not only that, but the mitochondria also acts as a signaler. So it helps to signal the processes that the heart needs, but also it signals the immune system. So it doesn't just play a role as energy, but it plays a major role in immune function and in also creating water for the body. So when we have major issues that can disrupt that, we can then affect the heart either to go less, as far as having a lower heart rate, which people can have problems with, which we see in chronic illness, or it can play a role in hypertension and having a higher heart rate. And so that's where I see a lot of problems that can exist within mitochondrial function. But really, it's a massive role that you see with people in all kinds of health issues, not just the heart, but specifically when we're dealing with, in what we're talking about today, the heart. I mean, 40% of the cell in the muscles of the heart is taken up by mitochondria.
That's interesting what you're saying, Dr. Watts. I was just thinking, so if somebody, it seems like it's not related, but it is based on what you just said. If somebody has an immune system problem, is that affecting the function of the mitochondria? Is it the other way around? I feel like already as I'm listening to you, it's the chicken and the egg. Which comes first? I would imagine there is a very strong connection and people should appreciate if they have immune system issues like, gee, I get colds all the time or flu every single year. Hello, that already is putting you at a greater risk for heart issues because the mitochondria would be affected. Is that fair to say?
It's very fair to say. And that's a good point right there is that with the immune function, if we're using the ATP molecule outside the cell, then it's used as a signaling molecule, not as energy. So now how are we going to do all the reactions that the heart needs to do or that our cells need to do? It can't because it's being shifted. So when you get the flu or you get the cold, what happens? Energy levels go down, you get fatigued, you get tired. Well, that's the normal reaction so that our body can fight the infection. So we're going to be tired. And we're not going to have that ATP molecule being used for energy. So that fuel kind of goes away, but it's used in a greater purpose, which is the immune function. So that's a really good, valid point of what needs to go on. And it affects the heart because there's diseases that can happen in the heart directly. We've heard of bacterial infections in there that can cause massive heart disease and even death. There's infections that occur in the body, but have an affinity for the heart, and then it affects the blood flow. It affects the viscosity of the blood, but also it affects the things like anemia, nutrients. So now the heart's not getting the nutrients it may need because of those infections that can be in there.
It's interesting too. I was also thinking about all the people out there who may not, on the surface, be really suffering with a serious health problem, like we said already, a cold or a flu. Obviously somebody's sick. But they're just tired from a low-level infection in the body that's been undiagnosed. They don't even know that it's that issue that they're having that could be causing an irregular heartbeat or their heart to be functioning poorly. And over time, years, I'm thinking, so many people out there must go through this. They're dealing with a low-level infection. It's constantly as a vicious cycle, playing on their mitochondria in their heart. And later, there's a serious problem, irregular heartbeat or something more serious with the heart. And then, of course, the cardiology steps in and says, oh, look at that, you have a problem in your heart. But nobody's backward engineering this and seeing that, well, wait a minute, well, this chronic fatigue is way more serious a problem than you just kind of feel sluggish and you want to take a nap today.
Absolutely. And the thing is normally we see issues with the cardiologist when it's high blood pressure. We're not really talking about low blood pressure. So I have a couple examples with that. One, I had a really close personal friend. My parents were best friends. This lady used to babysit me, and she called me up. She's like, my husband, we took him to the hospital. He's 82 years old, and his blood pressure is really low. And he's having light spells, and he's fainting. And so they took him in. They gave him some IV, some fluids, and they failed to ask him one thing. They failed to ask him if he's on any blood pressure medications. He was on three blood pressure medications. So that's the first thing. He had lost, he started exercising. He had lost 20 pounds. He started eating healthy and drinking a lot of water and walking the neighborhood and the dog. So with that, his health got better, and then his blood pressure dropped. So that's one example of what can happen in a normal person that has no idea about any disease. The other thing is I personally went through my 40s not even being able to work out. I didn't have enough energy in my muscles to function and work out. My blood pressure usually was somewhere between 100, 105, over 60 to 70. And so I didn't have any massive health issues other than the fact that I had severe fatigue, joint pain, some headaches, just things that you kind of get when you're getting older is what people would say. And as it comes to it, I had issues with chronic Lyme disease and Babesia, which is a co-infection that is a red blood cell parasite. And then I had some other infections that we cleared out, and then it changed everything for me. So now in my 50s, I'm able to work out again. I'm able to have so much more energy to accomplish everything I need to. But here it is. I look great on blood work. Doctors thought I was just fine, but then I was still struggling with a lot of own personal issues, which made it really difficult for me to be the dad that I wanted to be. Because I had kids at 37 till I was 46, having children, and being able to have the energy to spend with them, being able to participate in sports and do what you feel like a normal dad would do. And I didn't have the capability at that time. I would come home, crash for a couple hours, get up, eat dinner with the kids, put them to bed, and then crash again. And that was my day. I was just surviving my day. And many people go through the same type of thing.
So help us a little bit more to understand how important the mitochondria really is, just in general. Some of the other biochemical processes, all of these things. Help us out with that.
So the biochemistry is really important within the mitochondria because it signals over 500 biochemical reactions within the body. That's very significant. It also helps with our hormones. So it helps to make hormones, and it's a vital role in adrenal health that a lot of people talk about, like adrenal fatigue. It could be that you have mitochondrial dysfunction causing that issue, going deeper. The other thing with it is to get people better in any type of illness. The mitochondria is essential because unless you repair the mitochondria and go through the factors that are causing it, you're never going to have enough energy to overcome that problem. And one of the biggest areas I see today in research is mitochondrial disorders. All these kids are being diagnosed with mitochondrial disorders. They can't function and get out of bed, and they're 12 years old. And the aspect of what to do with that, it's like, we just blame it on it's just a disorder. It's just a dysfunction. Instead of saying, no, there's something really causing this. The mitochondria are not only important for getting that clean water, which our body needs to nourish, because a lot of times we don't drink enough water ourselves, but the signaling for the immune function, with that process, the making of our hormones, neurotransmitters. So, what kind of epidemic do we have today with, depression, anxiety, to be able to build muscle, to grow, to repair our bodies? Those are all part of what the mitochondria is doing, as well as signaling. So it helps cells to understand what to do and what needs to go. They have their own DNA within themselves. So we have our DNA, the mitochondria within that process has theirs, and that can be damaged, which then causes issues with replicating more mitochondria.
Yeah, this is exactly what you're talking about, a cellular energy. I can see where what you're describing, if there's mitochondria dysfunction, then you're going to have trouble with all these other things that I think people recognize as being issues. I'm having trouble detoxifying. I'm having problems inside my gut. Or I'm having these kinds of, why am I so sensitive to things or reacting like I am? You're lacking cellular energy. Even with cancer, I know a lot of people listening to this kind of program, they've already heard this a lot before, that when cellular energy is so low, you're at a much greater risk for having cancer and have a much harder time recovering from such a diagnosis if the cellular energy is low. how do we take somebody from very dysfunctional mitochondria to better health? How do you talk to people about that?
So what I tell people is, one, what are you eating and consuming? So you have to look at what the intake is. Water has toxins in it today, our food, and air. So how can we get a better and cleaner environment? That's the first thing. The next thing is looking at, are we deficient in nutrients? And most people I work with and have coached in the past with their own health is they eat a really amazing clean diet. So I don't think it's nutrient deficiency, but in functional medicine, we always go back to, let's give you more nutrients to get your mitochondria to work better. But in reality, it's the fact that there's a toxin or infection that we need to clear out. So that another process is what else stimulates the organs in the body to work the way it needs to. And that's the brain, the nervous system. And the biggest load on mitochondria is the nervous system. 10,000 mitochondria per cell. Some parts in the brain have 2 million mitochondria per cell. And we want our vagus nerve to work well, which innervates the heart. Well, I think we need to be sure that we have a really good nervous system functioning well, and the mitochondria has to be taken care of at that level. So toxins are stored in fat, and the nervous system has a ton of fat in it, and that's part of what makes the sheath around the nerves, as well as all the brain tissue, is cholesterol and fat. And
let me stop you for a second. Just check if I'm hearing you right, because there's two major things that you just said. I'm listening to all these public health experts talk about how they want to protect people from bacterial and viral loads, and all these cardiologists out there that are just saying the key to protecting your heart is take a statin drug, make sure you stay on your blood pressure medication, manage yourself, that's the smart thing, and you'll be okay. And I heard a couple things that really just blew me away by what you were just saying. Infections and toxins in particular, a lot of people out there might feel like, I'm eating pretty good, I'm exercising, I'm even trying some meditation. But two things that they got to look at more, if I heard you correctly, is what is the toxic load you're still not addressing? And you said nervous system. How many people out there are so afraid, worried, nervous about things? And just that alone, which I'm sure most cardiologists, conventionally speaking, are not talking to their patients nearly enough about things that they can do so that they can feel calmer, to go from a sympathetic to a parasympathetic state, because that would have a direct impact on improving your cellular energy, no?
absolutely. If you think about that process, how you think and how you feel creates hormones. It creates physiology. So if that's creating physiology, that stress will then either build your body up or break it down. So if we have poor thoughts, we have negative thoughts, we're around constant stress, that will be catabolic to our body. If we have positive environment to be in, we're working out, we're doing things that make us think well, then that'll help build our bodies up and repair. So it's a huge process in how we think. When I'm working with somebody, mindset is one of the biggest things I have to deal with. Is chronic illness for the last 10 years or 20 years, how can we change that mindset to think in a way that you can overcome this? And that process has changed to work with. The cholesterol part of it, you're talking about how our society has made one thing look like it's bad. In reality, it's trying to repair. One of the top drugs prescribed for men is cholesterol meds. And one of the second drugs prescribed for them is meds for ED. And so, Lipitor, and then you have to have Viagra to follow up with it, because where does testosterone come from? The cholesterol. And so we need the specific molecules to rebuild our body, but it also causes problems in the brain, because so much of the brain is composed of cholesterol. And if you want, there again, good heart health, you have to have good brain and nervous system health. And then what can have a major impact? Anxiety today. Anxiety is everywhere within our society. Just the anxiety of the general environment, but also just I see teenagers and kids that come into my office, my clinic, with major anxiety. and that changes just how their whole body expresses, and then it goes right into illness. It can go right into heart palpitations. How many people have had heart problems? They go to the doctor and everything checks out perfect. Probably half of them. Probably half of them, because it all has to do with the way they're thinking or the stressful environment that they're in.
Why don't we talk, because you mentioned kids. I think most people in general, even beyond, say, middle school, high school level, college kids, but older too, with all this technology now, EMF pollution that we hear so much about, right? We're talking about mitochondrial health here. How serious an effect are you seeing with cellular health, the mitochondria function, in relationship to how exposed people are every single day to wireless microwave radiation? Because that's what it is. The smart meters strapped to people's homes, the cell phones, the cordless phones. I'm talking all of it. Baby monitors, laptops, wireless, living, working in hot spots. I mean, that term already freaks me out. People should think about that more. These hot spots, what kind of effect does that have on the mitochondria? There's research that shows that it's not so good.
Exactly. Think about it. Our bodies are electric. The mitochondria function, the cells function through energies and frequencies, and without that, then it's going to cause destruction and damage, and both to the mitochondria and to the whole cell, and then from that standpoint, damage to our bodies, and then mutations, cancer can occur, right? So there's been things where we've seen research on those types of frequencies that can destroy cell function and cause cell mutations, and then the cancer issues. But it causes all kinds of health issues. So being aware, and I heard one guy talk about, I want a dumb house, not a smart house, because the smart houses are wired to the galore, and you're exposing your body to so much of the EMFs, which really aren't healthy. So what do you do about that? Because can we escape it? We can't escape it. It's our world today. And then they launched 5G. It's 4G, and then 3G, 4G, 5G. So I've worked on solutions to help people overcome those things. You got to charge that cell. You got to get that electrical connectivity going on, and you got to have things that will go, molecules that will go in there and fix that and repair, and buffer against that damage.
I know you wanted to talk about organ shutdown. I don't know exactly where you want to go with that, like the order of it. Where does the heart fall in that list? When I saw that you wanted to cover this, the first thing I was thinking about was, God forbid people get to this point, but I guess we all get there at some point. I'd always learned that the last days of your life, it's kidney function. I mean, as soon as that just kind of kaput and none of that is really working for you, that's usually a sign that you're not going to be around for too much longer, unless you, God forbid, died of an accident right away. So how do you talk to people about organ shutdown and that whole process, I guess disease process?
So think about our elderly population. Where are they struggling the most? The first thing that you see they struggle the most is brain. There's dementia, Alzheimer's, Parkinson's. I mean, there's a whole list of, I just don't think well, I don't have a good memory so much. It doesn't have to be at a level of Alzheimer's or dementia, but just the memory part.
Yeah, I mean, just to interrupt you for a second, just way before that even, an official diagnosis, somebody's reading something in a book or even online, and they can't get through a few sentences without losing their concentration. Something's going on, right?
It is. So you go back to what has the most mitochondria, what requires the most energy. So when your mitochondria function is going lower, and it does as we get older, then the ones that have the most mitochondria will suffer the most. So the brain first, and then the eyes, and then the heart, and then later on the liver has up to anywhere from 500 to 2,000 mitochondria per cell, and the kidneys somewhere around that, around 500 to 1,000, and the muscles in the body, same thing. The muscles have around 500 mitochondria. So it's the demand where you have the biggest demand of mitochondria is going to be the most affected. So that's where that question goes, because we can really see that in our population today. Is the elder, they have problems with the heart and they have problems with the brain.
So let's talk about the person that's really suffering out there. Poor concentration, heart arrhythmias, really low energy. They're in bad shape. They can't really go out and exercise really well. As you mentioned before, their mood is, you know what, this is a little too much for me to even concentrate on what you're getting into, Dr. Watts. How do you bring somebody out of that? What are some of the first things you should do so that obviously the person's energy goes up, they can concentrate a little bit better, their mood is elevated, now they're literally able to do more later. But what do you do at the beginning to get them out of the woods?
So the first two things I focus on, one is drainage, which you probably talked with Dr. J about, and being sure that your body has the ability to allow the toxins out of the body. The other thing I look at is the energy. So how can I support mitochondrial function? And I have the process of electrifying that, because the heart, for example, the heart is electrical. If we can get the electrical conductivity up in the body, then that's going to function better. And then from there, we go to the gut, because the gut has so many things it has to process and either take care of. So if there's infections, parasites, yeast, fungus, bacterial problems in there, which a lot of people do have, especially as you age, then it's going to require a lot of energy to deal with that. So then we clear the gut, we allow then the body to have the ability to absorb more nutrients, to have less stress on the immune system, and to be able to shift that energy up towards building and repairing the body. And then from there, we look at more systemic infections and then detoxing down to that cellular level that you've talked about, down to the mitochondrial level of clearing those toxins from the mitochondria, getting them working better. But a big part of what we see is like what damages the mitochondria, what damages the cell and the tissues in the body, the brain, the heart. It's the free radicals. It's the toxins cause free radicals. They go in there and they pounce around and they damage the cell membranes, they damage the DNA, they damage the processes that you want to be able to be sure to do, to make hormones, for example, and neurotransmitters. So if we have to be able to come in and bind onto that free radical. Oxygen is vital for that. And then from there, it goes through and is converted to water in that process. And then we want to be sure that we get rid of what's causing the damage in the first place, so then the cells aren't mutating, and then that can go to, further on to either more damage or cancer.
I would imagine what you're describing, especially at the beginning, just like with exercise, which I've often talked to people about in my past life before the internet. I used to do a lot of athletic training. It's very easy at the beginning to overtrain. If you're reckless, you can hurt yourself. I would imagine it's the same thing with bringing somebody from really low energy to more energy on a mitochondrial level, like trying to detox too fast. And it's just, if they don't have the energy, you're overwhelming yourself. So the first thing I'm hearing from you is get away from something that could be poisoning you. It's really a big deal, right?
It is. Mold is a big problem today, especially down here in Florida, down through the south, even the Northeast. You see a lot of mold, mycotoxins that can cause severe mitochondrial suppression and overall chronic illness. And the major problem is people don't even know they have a health issue. It's such a low-level thing, but it's there underlying. And when you look at what you're referring to on there's low energy, well, when we make energy through a process called glycolysis, it's either going to go into the mitochondria through aerobic respiration, or it's going to be converted to lactic acid. So a good way to explain that is when we were all young and vibrant, we used to run. And I could either go jog, and I could jog for a long time. That's be aerobic respiration, where I utilize my oxygen. Or I would sprint, and that oxygen would be gone, just like that. So that would then convert to lactic acid. So if we don't have oxygen, the biomolecular oxygen the cells need and the mitochondria needs, then we don't have the ability to then bring it through into aerobic respiration. So then you go to lactic acid and the fatigue really quick. So for the people that are wanting to get more energy, that's where aerobic exercise is good. Drinking a lot of water is really good. Proper breathing exercises is very important, and then there's supplementation that can really help with that process as well.
So, Dr. Watts, for those people who have, and there's a lot of them, concerns about high blood pressure, they're pre-hypertensive, hypertensive. What should they know from you?
Well, a couple of things that we need to look at. One is the part of there's stress that can cause more hypertension. So we have a sympathetic nervous system and we have a parasympathetic nervous system. And within the parasympathetic, we have two parts. We have the ventral and we have the dorsal part. The sympathetic puts us into hyperdrive. That's where people are seeing more just high blood pressure issues, and it's the environmental stressors that can create that problem.
And to be clear, though, for all those people in reality who are worried about the future, angry, resentful, or whatever about the past, all of this emotional makeup of people who tend to fall into that category, that is driving them in a sympathetic way, like almost 24/7, right? Unless they go to sleep, they get a break maybe for a little bit, but that's not a good thing, right?
You're right, it's not a good thing. It's funny because what do people that are retired do? They're watching the news 24/7. So I tell them, and I told my parents too, don't watch the news. You're not allowed to watch the news anymore. Don't watch. It's all about creating chaos and stress in people's lives. So try and get into an environment that's less stressful with that. And with the parasympathetic nervous system, the ventral is there just to pull back the reins, get you calm, get you feeling good. The dorsal system actually shuts it down, just completely pulls it back and stops it down, which can create other problems. But what they're seeing is really they're in sympathetic drive. They got to get out of sympathetic drive. Another thing to consider is who they're around and what those people are like around them. Are they around people that are driving stress and negativity towards life and towards them, which causes those hormones to release? And then the other thing to consider is forgiveness. Do you forgive yourself for whatever's happened in the past? Do you forgive others? Do you move on with life? And that can be a hard thing. And I've had multiple conversations in this realm with people that either are believe in Christ and understand what He died for, or that just believe in just a bigger being. And it really, we all make mistakes in life. We're going to get knocked down, and then we just have to get back up and just like, hey, it's over with. I'm moving forward. And I had this conversation with somebody yesterday, and I said, look, this is like being in the ninth inning. Your bases are loaded, and you're the pitcher. And 1 out to go, and you give up that grand slam. You got to come back the next day, and you got to perform. And forget that you lost that game the day before. And that's life. Life is the same way. We're going to have those times we get knocked down. You get up, you forgive yourself, you move forward. And if you can balance out the emotional part of your life and the stress in your environment, that's going to be really tremendous for your heart health.
It's so big what you're saying. It seems simple. I'm sure most people listening, hey, that makes sense. But still, this is a big problem because conventional cardiology might say something to the extent of, are you feeling stressed? Because it's like a 3-minute visit they're getting. The person might admit it, they may not. And the cardiologist or the doctor in an office might just quickly say, without even diving into it, they see high blood pressure, you should really reduce your stress. And then that's about it. But what you're talking about are really simple things to break down for each and every person out there. A person, oh, it's great to live in the present. But so many are living in the past, beating themselves up really hard on themselves. I love what you said because I connect with you about what athletes do. I trained high-performance athletes. And what most people admire about them is the fact that they stay so cool, calm, and collected under very, very stressful situations, doing things physically at a very high level in front of seemingly all the people in the world that they care about. They should be flipping out and be highly stressed out, and they're not. Every single point, every single play is an event in their life, a moment, and just let it go. They don't take it personal because what they've got to really be focused on is the next few minutes, next few seconds. It's important to look forward. And I love what you said also about just stop it, talking to older people about where are you putting your attention? Just simply, where are you putting your attention? Just kind of spacing out in front of a TV with constant negative messages, what's the byproduct of that going to be? Poor mitochondrial function, poor emotional health, poor overall energy. Excuse me, how's your heart supposed to get better? How's your cardiovascular system supposed to be better? And then on top of that, you're pouring in the medications to be okay? How is this all going to work out in a positive way for anybody?
And the medications, how many of those are shutting down mitochondrial function? Probably about 50% of them. So that's a whole nother subject in time, but it's amazing. But going back to what you were talking about there and what we've been mentioning is, what's the purpose? Are you living your life with purpose? I've had this conversation with my mom, like, stop watching the news and go spend time with one of your 39 grandkids. Go serve, go be of help to somebody, because by being a part of a bigger purpose and mission, man, that's where life is. If you find joy, there's fulfillment in that. It's so much of a better way to live by doing that. And so,
but I can hear the voices out there. What's my purpose then? Okay, I get it, but I'm struggling with that. But it still goes backward engineer. It still goes back to, I would still challenge the person and say, if you're spending a lot of your time, and like you were saying also about people around you, with the negative stuff going in, then how will you ever figure it out? And I'm saying it with all due respect. I know that can't be a good place. My purpose is to sit here, is to do this kind of stuff. I'm sure of that. It really feels right that I do this kind of work. But if somebody doesn't know, it's probably just a simple thing of looking at, and you've got high blood pressure and you've got cardiovascular issues. I said this a lot with kids when I used to train them for athletic performance, and they cried after they lost, and they wouldn't get what they wanted. They weren't achieving a better level. I said, would you just cut out all the BS? And I said it with all due respect. They had a good connection with these kids, so they heard me loud and clear. And I want to get your take on this. Every one of them, I said to them, you know what you have to do. What did you say? Oh, my tennis serve wasn't good, or I can't kick that ball well. You knew what the problem was that's making you feel so terrible. Now are you busy doing all you can to make that better? I feel like all of us know, I'm eating a little too many sweets, I'm drinking a little too much, I'm sitting around a little too much, I'm stressing out over this thing, and it's not changing at all, and it's not helping for me to be so worried. It's wearing me out like crazy. People tell themselves exactly what's going on and, in a sense, what they need to do next. Now it's a matter of, do they do something about that or not? And for how long do they stay with it to make the changes needed so that they can get out of the woods? You know what I'm saying?
yeah, I was an athlete. I grew up, I loved sports. I lived and breathed sports growing up. And so with that, same thing, something happened, I messed up in a game, and I would stress out about it afterwards for days. And I realized in life, as I got older, it's not worth living like that. And I've had this conversation with my wife, because I'll come home from work, and I'm at home. There's no conversation of what happened at work and what was all this. I'm like, I'm done. The stress is out. It's gone. I'm in my box. I am here to enjoy my time with my kids and not rehash what happened the rest of the day, right? And I realize I still have to connect with my wife in that way and help her feel good. But I prefer in life to leave those things that are stressful behind me. And we're all going to have it. That's part of how we grow. It's part of how we make progress in life, is to go through stressful times. But how we handle that is what makes or break it. It's how we move forward. Is that going to cause more damage to our health? Because it does make an impact on our health. I had a guy that I knew, and he moved to Boise from Chicago. He's a big financial guy on the markets there, and he had a heart attack early 30s, and his doctor just said, "Look, you're done. You can't live this lifestyle anymore, and you can't work in the commodities trading market. And he moved to, at the time, Little Idaho, and completely changed his whole lifestyle. And he realized that he couldn't keep going on because the stress that he was and the environment he was in caused him to have that heart attack and damaged his heart.
What are some of the things as we close out that people might be able to consume? Because I've often said throughout this event and many of the other programs that I've done, the idea of what we're talking about, your thoughts, your feelings. Okay, for some people, flip a switch and think and feel differently will affect you physically. But in a lot of cases, just physically changing your habits, like some supplements or other things that you might want to bring up, if we do those new things, that will start to spark better thoughts and better feelings. So we've just talked about how all these negative thoughts and feelings can be very destructive. What are some of the supplements that we could take maybe that'll help us to feel a lot better on a mitochondrial level and our whole life for that matter?
I think if we have more energy, then we feel better and we think better. So with that, there's these molecules, fulvic acid, humic acid, that can really help with charging the cells in the body as well as detoxing.
Where do we get that from?
So Microformulas has products like that, and that really go after and repair the mitochondrial level. And then just going through and detox it, so taking those products that will help you to detox and cleanse your body, because the heart function and the mitochondrial function within the heart is damaged by the food we eat. The toxins that are in the meat we eat, the toxins that are sprayed on the foods that we eat, the glyphosates and pesticides, herbicides, insecticides, all the things we spray all over our foods and we grow them in, that all damages the heart. So we have to look at taking things, not just supplements, vitamins, and nutrients. We have to look at taking binders and molecules that will help to remove those out, that will then restore the function.
But every chance I get, I always say to people, they're told, organic, same nutritional value as non-organic. In general, the food quality has gone down because of farming practices, but there's no doubt that that's a bunch of malarkey. That's just bull. The more you can stay away from conventional stuff, animal or vegetable, whatever, that has more toxicity, and you can eat more organic, clean, local, really well-raised food, the better for you. Don't believe this nonsense that there's no difference between organic and non-organic, right?
I agree. There is a huge difference, especially when it comes to the meat. And the red meat, the chickens that you eat, if they're just picking on stuff that's toxic, it's going to be in the muscles and the food you eat from them. So it has to be clean. And then what they put on, how do you think you have this beautiful piece of meat sitting in the grocery store for as long as it does? Okay, it's soaked in stuff that is not good for your body. So going and getting local grown food, and beef and chickens and anything else that you do locally grown is, in my opinion, is the best.
Yeah, and it's actually less money. It isn't this notion of you're going to spend so much more. Find people as close as you can to where you live to get it. What about, like, we've talked about CoQ10. Of course, a lot of people heard that message, but other elements that would help improve mitochondrial function, again, assuming that the person is doing really well with the first part that we talked about. Get away from toxicity as much as you can. You're doing a great job with that. But some other things to kind of move things along and to move up cellular energy would be, what else could we take?
Yeah, so required nutrients are B vitamins, B1, B2, B3, B5, B6, and B12. And then B9, which is folic acid, can be very beneficial. Alpha-lipoic acid, you have the CoQ10, especially if you're taking cholesterol meds, because it depletes it. The aspect of just being able to digest your foods so you can get those nutrients. So enzymes, hydrochloric acid, digestion is very important in assimilating these nutrients. And then water, and water is going to be probably better than all those. Because when I've seen a lot of the elderly patients in my practice, a lot of them don't drink very much water. In fact, one gal, she said, I don't remember the last time I had water. I just drink coffee every day, all day long.
I know a lot of people who are older that take their medications just by swallowing the pills and no water at all. They're just swallowing the drugs. And all that toxicity and being dehydrated, what a terrible combination.
It is, and then you don't have the oxygen and the hydrogen your body needs to repair, because those molecules will split apart and then they're utilized. So many reactions within the body require hydrogen, and a lot of them require oxygen. In fact, in the liver, the first phase of the liver to detox is all require hydrogen and oxygen to be able to go through that process to make that molecule less toxic. So their enzymes are called oxygenases and hydrogenases. And then electrons are needed too. So that's where the fulvic minerals will really help with getting not only the electrons, but then the protons, the hydrogen, and the oxygen in the body.
Just as we close out, the last other moment that I had on my mind, you mentioned minerals. I think, generally speaking, too many people are mineral deficient. Minerals, generally speaking, are way more important, right, than most people, I think, appreciate in terms of improving cellular energy and making the whole body work well, right? I mean, I'm thinking when it comes to hypertension and cardiovascular concerns, so many people hear, oh, salt's not good, but it's conventional denatured salt, sodium, that they're eating way too much of. That's no good. But then just a little sea salt. I mean, the sea vegetables that I've eaten over the years, and just a little teeny pinch of sea salt, putting that on my tongue when I'm feeling very stressed out, when you're talking about all the stress that people deal with, has such a great grounding, good feeling for me when I know I'm consuming just a touch of minerals sometimes when I'm really in a very stressful situation during the day. I don't know if that makes sense to you, but I think that for sure people need to be thinking more about the quality of the minerals that they're taking into their body, right?
Yeah, the minerals and the electrolytes. So you're getting a lot of electrolytes from that. And that's super important because that's how the heart and the heart muscles really react to chloride and calcium and magnesium and sodium and potassium. So those are the most common there. And then plant-based minerals or plant-derived minerals are the most assimilated and natural for our bodies to take.
Good information, Dr. Watts. I'm sure that people are going to be thinking quite a bit more about the importance of their mitochondrial health after this talk. So thank you very much.
Welcome.
I hope you enjoyed day 7 of the Cardiovascular DocuClass. In tomorrow's episode, we've saved the best for last with some of the most important messages of this entire event, especially as it relates to cholesterol, statins, and fixing a damaged heart. By the way, as a quick reminder, if you would like to own a copy of the Cardiovascular DocuClass plus all the other bonuses available today, simply click the link you see on this page and choose the package that best fits your needs. Talk to you soon. Take care.